السلام عليكم. أنا أحب أشكر دكتور سامي سعد ودكتور سامي عبد الصمد ودكتورة عزة فكري، هم مش موجودين بس. النهارده هنتكلم على ال virtual reality and primary dysmenorrhea. أنا ملك المهدي Women Health Lecturer في الحياة University. أكتر quote بحبها إن ال body is a self-healing organism. It's all about clearing things out of the way so the body can heal itself. البرايمري ديسمينوريا في الفترة الأخيرة بقت تبقى زيادة جدا في بعض الدول، بتتزايد سنة عن سنة وموجودة كتير جدا، بتأثر على الفيزيكال والسايكولوجيكال بروبلمز بتاعة البنت. أكتر حاجة بتعاني منها هي بين رهيب جدا لدرجة إن هو بيخلي المود بتاعها وحش جدا، وكمان بيخليها to miss her school and work. How do we deal with this pain? They give her painkiller. But when we give her painkiller, does this solve the problem or just put the alarm off, the alarm of the fire? When I'm talking to you now and there is a fire and I just put the alarm off, did the fire is off? Put off? No. The fire is just there. I just put the alarm off. This what happens when we use the painkiller to put the pain off. We know that the pain is a cause of from the nervous system, that there is an injury inside the body. But when we have pain during dysmenorrhea, there is no injury inside, as we still have migraines without an injury. We still have a pain in the lost part of the body, which is the phantom pain. And you can even have a pain in a missing part you never had before. This happens. Why? Because the brain collects or puts signals in consideration. As it takes clues from the surrounding, the smell, the sight, the colors. All of this it takes in consideration. It goes to the memory and see if there was a problem like this before you faced or not. And it takes for the beliefs that is found in your mind. The mind takes all this data, collect it, and ask one question. Do I need to protect myself? If the answer was yes, and the brain feels that there is a threatened situation you are put in, it will produce pain. We have two types of mind, conscious mind and unconscious mind. The unconscious mind controls us with 90%. And what does it have? It have emotions, habits, personal beliefs, situations we passed through before. It records the smell, the colors, the situation. Everything is memorized in the unconscious mind. And when the girl or anyone is put in the same situation again, it goes to the mind, the unconscious mind, and see if we passed through this situation before or not. Is it threatened to my body or not? Let's take this concept and talk about period. When I have this photo in front of many girls here, what do you feel when you see this photo? When I asked a lot of girls, I found that it's painful, it's shame. I'm forbidden to talk about it. It's dirty. I hate it. I hate my body. I hate to be feminine. All of this answer, I got it from many girls. This is because the beliefs we took about. In some countries, they celebrate the girl when she has her menstruation, because menstruation means normal physical body. But here in the Arab, we tell her, stop, you're a grown-up, you have to change your attitude, you have the period is painful. You will feel pain. You will feel you may miss school or work. We tell her many and many beliefs, and because we don't ever give the students syllabus about the women health in schools, so they take their information from the surrounding of her life. This will affect her, and the brain translates all these beliefs into fear and stress. The girl, before having her period, will have all these beliefs will come up from the brain, and the brain, to protect it, it will give fear and stress. This stimulates the sympathetic nervous system, and the sympathetic nervous system is for fight and flight. And it increases the cortisol hormone, which affects the prostaglandins, which affects our periods. What we want to do is stimulate the parasympathetic nervous system, which is for rest and digest. How? By the vagus nerve stimulation. The vagus nerve is known as the wandering nerve. It is the most powerful nerve for stimulation of the parasympathetic nervous system and changing the beliefs. So we use the virtual reality. And as Dr. Dalia said to you, virtual reality were used in the normal labor, were used in the insertion of the intrauterine devices, and it is more than powerful for the pain. So it distracts users, decrease pain perception, and promote relaxation. Our session takes from 30 to 45 minutes VR session. We treat her in the first and second day of menstruation in order to know the effect of the virtual reality relaxation on the patient when she's having her pain. A patient in a relaxed position and keep dehydrated. First of all, we teach her when she put on the virtual reality, we teach her the child pose and happy child pose. Both of them stimulate the vagus nerve, so they stimulate the parasympathetic nervous system. We also give her breathing exercise, progressive muscle relaxation, and guided meditation. The breathing exercise, we teach her the diaphragmatic breathing, box breathing, alternate nostril breathing. The diaphragmatic breathing, we increase the time of expiration in order to stimulate the vagus nerve. And the box breathing, it is used to balance between the two autonomic nervous system. Alternate nostril breathing, it is used to balance between the right and left hemispheres. So the three types of breathing are used in order to stimulate the vagus nerve and parasympathetic nervous system. Progressive muscle relaxation, and it is used to relax the body, put her completely in a relaxed position, and it stimulates the parasympathetic nervous system. When we used the positions and the respiration, breathing exercise, and the progressive muscle relaxation, we are completely now relaxed. We go into a guided meditation. This woman, during the session, has a headset to hear the guided meditation. During our session, we have aromatherapy in order to help her to relax. And she goes home with this odor in order to remember, get the situation again, the emotions, the movement. She takes, when she smells all the lavender مثلا, بتريكول تاني كل الموفمنتس وكل الايموشنز اللي حصلت في السيشن وكل البيليفز اللي احنا دخلناها. 432 hertz music. This is the music therapy. It's used برضه for relaxation and parasympathetic nervous system. ده المديتيشن أنا بس هجري بندخل affirmations during the guided meditation in order to change البيليفز اللي احنا قلنا عليها في الأول اللي موجودة فين في unconscious mind. After التريتمنت لقينا ان البنات دول بقوا بيناموا كويس، بقى بيimprove السيركيليشن، لقينا البروستاجلاندين قلت جدا، ما بقاش في muscle spasm عند الابدومن، فالبين قل جدا وبدات ترجع لحياتها تاني. دي بعض اراء الناس لما اشتغلت معاهم الموضوع ده. حقيقي كان اكبر حاجه بتقول ان انا اول مره ادخل الحمام الاقي البيريد جات لي بدون اي بين. ثانك يو.